Yes, here. We'll give 1 minute. There are 2 slides. After you've done reading this, there is little bit on next page as well.
Yes, ma'am.
Should I turn it?
Yes, ma'am.
Thank you.
Yes, ma'am. I'm ready, ma'am.
Just 16 seconds left. 15. Right. So if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient?
Ma'am, I will manage this patient according to ABCD protocol, which is
Okay.
airway, breathing, circulation, and if there is any dysfunction, CNS dysfunction, and E for exposure and examination of the patient, ma'am. So
Yes.
I'll
How?
assess the severity of
Yes.
the patient,
Yes.
and depending upon the severity, I will admit the patient in ICU or in ward, depending upon the severity.
Yes.
And
How would you assess the airway of this patient?
ma'am, I will check for if there's any obstruction,
Okay.
and if there is any noise, and I'll auscultate this chest.
What provisional or and differential diagnosis would you consider for this particular patient?
I will consider provisional diagnosis as acute pancreatitis. My differentials would be ascending cholangitis, a pseudocyst of pancreas, and um, um,
Perfect.
relapsed,
Yes.
yes,
All right.
recurring
Okay.
pancreatitis. Yes, ma'am.
Yes. All right. Okay. How would you confirm your diagnosis? What further investigations can you ask for other than serum amylase, which is high?
Okay, ma'am. So I'll ask for lactic dehydrogenase LDH, ma'am.
LDH.
Yes, ma'am. And further, I'll go for imaging. If required, I'll go for imaging, ma'am.
Which
Preferably
imaging? You
CT
have to
scan.
tell me. Yes.
CT scan, yes, ma'am.
Yes. All right. Can you tell me what are the causes of acute pancreatitis that you are thinking of?
You mean the pathophysiology, ma'am?
No, causes. If you are thinking of being a provisional diagnosis as acute pancreatitis, what might be the cause that you are getting from this image, from this stem?
Okay, ma'am. First thing, the patient BMI is 40.
Okay.
History-wise, the patient is having central abdominal pain.
Yes.
Anatomically, it is located to pancreas,
And
and her heart rate is 128. Tachycardic. Patient is tachycardic, which shows there is signs of inflammation and signs of stress response, and her BP is 80/40.
okay, you're answering the question, but you're not answering the question at the same time. All right.
Okay.
Please tell me the pathophysiology behind this condition of the patient.
Okay, ma'am. So the pathophysiology is it can occur because of any duct obstruction, so which
Okay.
may cause bile leak into the pancreatic duct,
All right.
and as a result, the intraductal pressure might raise, and there will be a ductal breach and a release of pancreatic juice into the pancreatic tissue, which causes acinar cell damage. So this is one theory, ma'am. The
All
other
right.
one is
Okay. Can you
uh,
please tell me what are the criterias which can you consider when it comes to acute pancreatitis? How many criterias for diagnosis are you aware of?
Glasgow criteria and Ranson's criteria, ma'am. Imaging wise, I'll go for Balthasar criteria, CT
Okay.
criteria.
Please tell me if patient after 48 hours, what is the Ranson criteria?
Yes, ma'am. I will check for the hematocrit. It should, if it, there'll be a drop of more than 10% or more. One, and second is base deficit of more than 4 millimoles, and there will be sequestration loss of more than 6 liters, and blood urea nitrogen more than 1.8 millimole, and um, calcium less than 2 millimole, ma'am.
This
And
patient has serum amylase, which is raised, right?
yes, ma'am.
Is it a
Yes, ma'am.
significant test to make the diagnosis?
No, ma'am, definitely not, because serum amylase is non-specific to pancreatitis. It can be elevated in other condition also, and it is not, and it has a short half-life, so it is not reliable after 48 hours of the attack.
All right. Okay. Can you tell me why would patient be tachypneic?
Ma'am, hello.
Yes. Can you tell me why would this patient be tachypneic?
The patient is tachypneic because of abdomen pain and because of diaphragmatic irritation due to abdomen pain, ma'am.
Can you tell me, if you don't get to manage the patient on time, what complications do you expect to see?
Complications, patient might go for systemic inflammatory response, ma'am, and there will be multi-organ failure.
Is that all?
And there are a lot,
Tell
ma'am.
me
Patient can go for renal failure. Respiratory wise, patient go for acute respiratory distress syndrome, and local complications are there. So patient can go for pancreatic abscess, pancreatic necrotizing pancreatitis, ascites. Patient can land up in splenic vein thrombosis.
Okay. Can you
Patient
please?
can have affective jaundice.
Thank you. Can you please tell me, how would you take care of the nutritional status of the patient?
Okay, ma'am. So depending upon the severity, ma'am. The patient is having severe pancreatitis. I will go for
This
total
particular patient.
parenteral nutrition. I will go for CVP line. If
Yes.
the patient is not, if the patient is having mild pancreatitis, I will encourage the patient to have enteral feeds or through nasogastric.
All right. Can you tell me two conditions in which patient has acute pancreatitis, but serum amylase is normal, or patient has serum. Yes. All right. Tell me first.
The condition, a patient is having pancreatitis and serum amylase normal.
Yes.
Maybe after 48 hours, ma'am. Maybe
And
the patient is presenting after 48 hours.
okay. All right. Can you tell me, right, how would you take care of patient's blood pressure?
If we have to start the patient on inotrope supports, ma'am, if required.
Okay.
And and if the patient blood pressure picks up, probably we can taper the inotropes, ma'am. Preferably noradrenaline.
Okay. Can you please tell me, right, you said you'll do the CT scan.
Yes, ma'am.
What is the criteria when you'll ask for the CT investigation or CT scan?
If the patient second CT scan, ma'am. If I'm
Or the first
suspecting,
one? You haven't even done the first one yet, have you?
no, ma'am. I'm sorry, ma'am. I'm not able to understand the question, ma'am.
Okay, when would you ask for CT scan? Because you said you'll do the imaging, but then yes, you gave me the answer. Imaging would be CT scan. So is there
Yes, ma'am.
any particular criteria that you would have to consider, that exactly after what circumstances you would ask for CT scan?
Ma'am, it could be maybe after 48 hours, and if the patient is not, if the blood values are high,
No.
and if the
After
patient is
5
not
to
recovering
7,
for the
yes.
management, probably I'll go.
Yes, after 5 to 7 days of admission, when patient is not recovering, that's
Yes,
when you
ma'am.
ask for.
Admission, yes, ma'am.
Yes.
And if I'm suspecting any necrotizing pancreatitis, yes, ma'am.
Yes, or the edema and the fluid collection, etc. So that was the answer. Good.
Yes, ma'am. Thank you, ma'am.
Thank you.